Today we'll be talking about kidney transplantation or renal transplant, kidney transplant if you like. And today I have an expert in the building, a consultant nephrologist who is around to do justice to the topic. About a fortnight ago, we had a consultant urologist, but today we have a nephrologist, a kidney specialist doctor. For the viewers, for the benefit of those of us who may not be conversant with these medical terminologies, that oftentimes can be very confusing. He is no other person than Dr. Theophilus Umeizudike. Is it Theophilus Umeizudike?
Well, thank you very much for having me in this program again, and I'm delighted to be around, and I'm trusting that we'll be able to educate our people more on kidney transplantation. Thank you very much, Dr. Barth.
Thank you very much. Now, let's look at a bit of history of kidney transplantation in the world. The first attempt, albeit unsuccessful, was carried out in the year 1902. It was done by an Australian, Emmerich Ullman. He did a kidney transplant, albeit in an animal. It was a transplantation that was done in a dog, but it was unsuccessful. However, the first attempt in humans came in the year 1939. This was carried out by Russian Yuri Voronoi. He conducted a transplant that was said to have lasted for a couple of days, though the kidney never worked. Okay? It wasn't until 1953 that a temporarily successful transplantation took place, carried out by Jean Hamburger. That was done in Paris. A 16-year-old boy was said to have received a kidney donated by his mother. Okay? That lasted for a few months. But a year later, 1954, was actually when a major milestone happened as far as kidney transplantation is concerned. And of course, that was the surgery, the transplantation that was done by Joseph Murray. He did a transplant between twins, monozygotic twins, okay? And that transplantation, that kidney lasted for as much as 8 years. That was a major breakthrough. And since then, a whole lot of improvements, advancements have actually happened in kidney transplantation. And of course, in Nigeria today, we have centers that have done transplants beyond 200, okay? And they are continuing. And today, like I said at the beginning, we have an expert who will be telling us what kidney transplant is all about. I'd like to start with a question. What is kidney transplant, sir?
Thanks for your question. Kidney transplantation essentially is a surgery that is done to give someone who already has 2 failed kidneys, give the person a kidney. Usually we don't tamper with the failed kidneys. We just go ahead and put in a new one around the right lower side of the abdomen, precisely in the area of what is called the right iliac fossa. So that's what a transplant is. And it's important to emphasize the fact that before somebody will undergo this surgery, we must establish that the person has reached what is called end-stage kidney failure or end-stage kidney disease or chronic kidney disease stage 5. And the person may be on dialysis or just about to start dialysis. So it has to be established that the person has irreversible failure of the 2 kidneys before you embark on doing a transplant, because there are people who have kidney failure, which could be acute kidney injury. It means that the kidneys are able to recover with dialysis or with some other forms of treatment that reverses the kidney function. But when the kidneys have failed because of long-standing hypertension, which is the commonest cause in our environment, people who have had hypertension for many years and they were not very compliant with their medications, it can lead to end-stage kidney failure. Also, some conditions called chronic glomerulonephritis, which is inflammation of the 2 kidneys that happens over years, that may be subclinical, the person doesn't know about it. but it presents in an advanced stage where the person is already presenting with symptoms. You will see people in their 20s or 30s, and they will tell you they never had blood pressures, and there might not be a family history of blood pressure, but they then develop this kidney failure. And so what's causing it in quite a number of them is chronic glomerulonephritis. Another cause of chronic kidney disease requiring transplant or dialysis is diabetes. Type 2 diabetes is the commonest type, and oftentimes people who have diabetes that is not well treated and controlled can develop kidney failure with time. There are other causes that I can go into. People who have conditions like connective tissue disorder.
Polycystic kidney disease.
Polycystic kidney disease, yes, which is the commonest genetic disease in affecting the kidneys, where the cysts keep becoming bigger and bigger, the kidneys become big and bigger. It's in such cases that we may contemplate removing a kidney so there's enough size for the new kidney that will be implanted. But for most people who have other forms of kidney failure, we don't really touch the kidneys that are diseased. We just go ahead and put a new kidney on the right side of the lower part of the abdomen.
Thank you very much. Now, you've talked about some of the major causes, okay? Can we have the types? What are the types available? I know that oftentimes we may have living donors, and of course, in some other situations, there may be diseased donors. Are there other types apart from those living donors and diseased donors? That's cadaveric donors. I came across something like preemptive type as well.
Okay, so kidney transplantation, like I said, it's offered to people whose kidneys have failed irreversibly. They need dialysis, and to be able to get them back to life, because kidney transplant has been shown to offer a much more improved quality of life, okay, compared to somebody staying on dialysis. So when somebody needs a transplant, it can be done before the person goes on to dialysis. That's the one you talked about, preemptive transplantation. So these are people who we probably have been following them up. They may not have, they may have a condition like hypertension or diabetes, and we follow them up because chronic kidney disease has been classified and staged into stage 1, stage 2, stage 3, stage 4, and stage 5, where the person needs dialysis. So if we've been following somebody up and the person is at stage 3 or stage 4, and we are monitoring the person, and we estimate that within the next couple of months, the person may need dialysis, the person can be offered what is called a preemptive transplant, especially when we have them in stage 4, just about to slip into stage 5. Okay, so that's preemptive transplantation. You do it before the person needs a dialysis treatment, but oftentimes, even before the transplant, the person may also still be offered some sessions of dialysis to just reduce the amount of waste that has built up over time. Okay, so there's also a living donation, which is what happens in Nigeria and many developing countries. Okay, so most people have 2 kidneys. You can donate one and be able to live with the one that you've donated, while the person who receives the 1 kidney can live with that one, because 1 kidney is enough by God's grace to sustain life. And then the other type is diseased donation or cadaveric donation. This is when somebody dies in the hospital setting and the kidneys are harvested, and the 2 kidneys are harvested, provided the person doesn't have kidney problem anyway. The 2 kidneys are harvested and given to 2 different patients. Now, the interesting thing is that with this disease donation, it can also happen for many of the other organs, whether heart, whether lungs, whether pancreas, intestine, any organ at all can be harvested from such people who die in a hospital setting. And it is preserved and given to someone who is on dialysis within a few hours, usually within the first 18 to 24 hours of harvesting the organ, so that the kidneys wouldn't have lost their function.
Talking about the cadaveric donor, sir, do we practice this in Nigeria at the moment?
No, we don't, but I can tell you categorically that Lagos State, in conjunction with the team at LASUTH, is working out the legal framework to enable us to do this in Lagos State. It is still at the level of
infancy.
Well, not infancy, because we've developed the legal document to be able to say LASUTH and other hospitals in Lagos can do a transplant, but it involves quite a number of things. So the legal framework has to be put in place so that nobody will accuse a hospital or any health facility of taking organs from people without consent and going ahead to transplant. So we want to do the legal framework very well and set up bodies that will be able to regulate organ transplant. It won't just be for kidney transplant. It will be for every organ transplant in Lagos State. So it's something that there was a public hearing sometime in 2021. And after that, they've gone back to tidy up and put the necessary things in place. And the Lagos State House of Assembly will work on that. And then they will eventually probably have another one before they send it to the governor for assent. And then we can look at starting diseased organ donation in Lagos State. And
Fantastic.
as Lagos State pioneers it will snowball into other parts of the country.
Fantastic. That's a good one. That's a good one. Now, I want us to also look at this. Oftentimes, we do know that in this part of the world, our health-seeking habit or behavior is not usually the best. What are the signs and symptoms a layman could see in his or her system or her body and will begin to suspect, should this be a kidney problem? Because oftentimes, by the time they are presenting to the hospital, the narrative is the fact that the organs are far gone damaged. Okay, so but are there signs and symptoms, danger signs, warning signs that when an individual sees, he or she should go and see his or her doctor with respect to chronic kidney disease?
Well, so the thing to say about chronic kidney disease, or CKD for short, is that the early forms of CKD are completely asymptomatic, just like hypertension and diabetes. So it's completely asymptomatic. So what we counsel people to do is to have a good health behavior in terms of, if somebody is getting to their 20s and 30s, they should find time to do some kind of checkup. Check your blood pressure, check your blood sugar, check your cholesterol, check your urine. Don't just do malaria and typhoid tests. So check all those things, and that helps you to clear and be sure that you are good. And then when people are asked to do pre-employment testing, if you're asked to do preschool testing, take time to do those tests. Don't go behind the scene to try and bypass doing those tests, because that may just be the opportunity to detect some of these things early enough. But again, we can say when people urinate and they notice that their urine foams a lot, it could be a symptom that they may have some protein in their urine, okay? And if somebody sees blood in their urine, of course, that one, they won't waste time. They will call you. They will reach out to their doctors. But when the urine foams, or the person wakes up often more than 3 times overnight to urinate, provided they don't drink so much water at night too, because people can drink much water at night or at bedtime and wake up to urinate. If you don't drink so much water in the evenings or at night, and you're waking up more than 3 times at night to urinate, it may be an indication that the kidneys are not healthy. And of course, if somebody's legs swell up, or if somebody's face swells up, that is an indication. Already by the time these are happening, there is some kidney affectation. And so it is asymptomatic in the early forms. You need to run tests to detect it. Just like blood pressure or hypertension, rather, is asymptomatic. It's only when you check the blood pressure that you detect that it is either normal or high or low. So you need to run some checks, and that's why I advise people, if you are asked to do some tests before you go into school, whether secondary school or university or pre-employment tests, do them. It may just be the opportunity that you have to detect this thing. And I also tell people, if you're doing your birthday, give yourself a birthday gift. Do some tests. It's likely not going to cost you between 10 and 20,000 naira to do those tests. But if you look at the figure you spend on airtime or data, it's probably more than what you spend in the whole year. And if you can just dedicate that amount to just check your health and see how your numbers are. That goes a long way in helping you know how your status is.
One of the challenges that we usually encounter in this part of the world is finding a match. And of course, that will take us to conducting a number of evaluation, blood typing, tissue typing, and cross-match. How do we get out of this in this part of the world? What is the way forward? Because I know because of that, we are limited to more or less doing more of related donors than unrelated donors. What is the picture in Africa with respect to Nigeria, sir?
Right, so usually you must make sure that the person donating shares the same blood group with the person that's going to receive the kidney. If that does not happen, then there might be what is called hyperacute rejection. Just like if you're donating blood to someone, you should donate a similar blood, or the person donating must be blood group O. So O, just like blood donors can donate organ, a kidney to any person who needs a kidney. Then we also have to cross the barrier called the tissue typing, or HLA. HLA stands for human leukocyte antigen. So your body is able to recognize your cells, and your immune system is able to recognize every part of your body, and then it doesn't fight it. But once a foreign antigen comes into your body develops antibodies against that. So that's what happens when people in this climate who have been bitten by mosquitoes develop malaria. You don't have malaria causing much of an issue. But if somebody comes in from abroad who has not stayed there before and is exposed to malaria, the body, if the person is not careful, he might die because of the fact that the person doesn't have antibodies that are formed against malaria. In the same way, when your body is exposed to a foreign organ, it mounts up antibodies against it. So we must cross that HLA barrier. And so that's why HLA typing should be done for any organ transplant, especially kidneys. There are about 3 loci that we look at: HLA-A, HLA-B, and HLA-DR. So out of these, there are usually about 6 places, each of them 2 places, that should at least match in about 2 or 3 places. DR is very sensitive because in a way it determines the long-term outcome of the graft. So if there are 2 mismatches at DR, we may not go ahead with the transplant. But if the DR matches in one place and there's a match in A and B, we can go ahead. Okay, so
before you go further, because I'm going to, let me quickly open the phone lines for our viewers who are home and around the world. At this time, you can put in your call should you have questions to ask, okay, or make contribution to the topic. Now, one of the things I do know that are currently being done abroad to probably guard against these challenges of mismatching is paired organ donation. Okay, is that possible in Nigeria at this moment?
So in paired organ donation, you have people that have issues with either ABO incompatibility or HLA incompatibility. So maybe somebody A wants to donate to B, and they have some challenge with having a HLA match. C wants to donate to D, similar challenge. But you can swap for C to donate to B and A to donate to D. And so in that way, you have a paired organ donation. And it's being practiced in some 10 centers in the country now, because we are going, we're doing our best to match what is obtainable outside the country by opening up and looking at ways to reduce, because the honest thing is that there are many people who need a transplant, but we don't have enough organs to go around.
Mr. Akpan from Abuja. Good morning, sir.
Yeah, good morning.
Yeah, how are you today?
I'm very fine, sir.
Yeah, please go ahead.
Okay, I wanted to ask a question, please. My son was born without a thumb, a right-hand thumb. I wanted to ask if we can do a surgery without the index transfer.
Okay, okay. Thank you very much. Did you get that?
Yes, I heard that.
Okay.
So I think virtually almost every organ can be transplanted. So it's for you to get in touch with your orthopedic surgeons and they will enlighten you more on that.
Yeah, thank you very much. You were talking about the paired organ donation and the
Yes,
plan
so
to...
I said there are many people on dialysis or who need a transplant, whether kidney or any other organ transplant, and you don't have enough donors, whether living donors or diseased donors. So what's being done is to see how we can expand the donor pool. And that paired kidney donation is something that has become practiced in some climes, but it's also available in some centers in Nigeria where people go in and they discover that they have HLA incompatibility between the donor and the recipient. They get another donor who may have a similar HLA matching with the other donor, and then they can swap donors and be able to get a transplant, because HLA matching goes a long way when you have a good match. Either the perfect is 6/6, which you may not get except in identical twins, like we talked about. The first successful transplant was between two identical twins. So their HLA was perfect, and in those days, you didn't have immunosuppressive drugs. But today, there are immunosuppressive drugs that can help reduce the chance of rejection, so that can help to prolong the lifespan
Just a minute,
of
once
the
more.
organ.
Pat from Abuja. Good morning.
Good morning.
Yeah, good morning, sir.
Thank you, sir. Can I come with my question?
Yes, yes, go ahead.
Okay. I've heard about kidney stone and how intake of water helps. But in a situation where one has kidney cyst, how can he be helped?
Where one has what? Kidney what?
Cyst.
Cyst, okay.
Cyst.
Okay, thank you very much. The nephrologist will do justice to your question, sir.
Okay, so kidney cyst, we talked about polycystic kidney disease earlier on. In polycystic kidney disease, that is an inherited disorder in which the two kidneys form cysts over years. They start forming cysts maybe about the teen or the early 20s. By the time the person is getting to about 30, 40 years, you will see that the cysts have formed in a huge way to make the person look as if they have something in their tummy protruding. So in such conditions, the person needs to be on some medications early on when it's detected early to reduce the cyst from getting bigger and eventually leading to kidney failure, because those are one of the things that causes kidney failure and somebody needing a transplant. There's also what is called simple cyst, which is not like this polycystic kidney disease. Simple cyst occurs as people get older, and it just comes maybe in one kidney. Sometimes it can be in both kidneys, but usually in people in their 50s, 60s, 70s, and it's like an aging process. As the kidneys age, sometimes they do form cysts. Also, some people who are on dialysis form cysts when they start dialysis. So it's something that not much can be done about it in terms of treatment, because it doesn't really lead to kidney failure, simple kidney cysts. But there are also some cysts that may have some association with malignancy. So that means if somebody has a kidney cyst, there might be a need to do a CT scan to exclude the possibility of that cyst being associated with a kidney cancer. So that's the way the cysts, simplified, managed.
Thank you very much. Now, I'll take you back to this question. When we talk about kidney transplant, one of the things that we usually worry about is what will happen afterwards when the person begins to take those drugs, immunosuppressant drugs, that will help to guard against rejection. And oftentimes they come with a number of... Mr. Iboko from Bayelsa. Good morning, Mrs. Iboko. Good morning, ma'am.
Good morning, sir.
Yeah. How are you today?
I'm fine, sir. I have a question.
Yes, please go ahead.
My abdomen, under my abdomen, beside my wrist, I normally feel pains every day, and it pains a lot. So there was the ones I went to hospital, I asked my doctor.
Left on the right side?
The left.
What side, ma?
Left.
Under the abdomen, under my rib.
Okay, go ahead.
I feel pain there every day. So I asked the doctor. He said that maybe I might have a stone, or maybe it's just pain. I'm not really clear about it, so I said, let me call. I'm watching the program right now, I said, let me call and find out if the doctor can clarify me on that.
Thank you very much, ma.
Well, it's difficult to know what's happening. The history is not enough. We need to investigate. She probably needs to do an abdominal ultrasound scan, possibly do an ECG because it's near the heart, and then there might be a need to do an endoscopy. So there are many things that could be happening. It could be a dyspepsia from GI disorder. So that would need a scan or endoscopy. And if it's happening all the time, it looks like an ulcer. It could also be a stone which can be picked by either an ultrasound scan or a CT scan of the abdomen. That will readily help us make a diagnosis. So you need to probably ask to be referred to a specialist so that you can see a specialist and that can be sorted out.
Thank you very much, sir. Now, back to the question I was going to ask. Challenges that could come with being on immunosuppressant drugs. Sometimes people who probably didn't have hypertension can develop that along the line. What is the way out?
Okay, so there are 3 classes of drugs that are usually given as immunosuppressive drugs. And the first one became available in the late 50s is athioprine. And that's alongside with prednisolone. However, in the 80s, cyclosporine became available. So most times people are on about 3 drugs, prednisolone or steroid, antimetabolites represented by azathioprine, and then more recently mycophenolate mofetil. Okay, and then the third one is the cyclosporine or tacrolimus base. So those 3 are usually part of most people who've done a transplant. Sometimes we could give what is called an mTOR inhibitor, which is represented by sirolimus or everolimus. So no drug is free of side effects. That's one thing I want to talk about first of all. The medications that the person was using before this happened had side effects.
Just a minute. Isaac from Abuja. Good morning, sir.
The side effects is nothing to worry much about. Yes, some of them might give rise to people developing post-transplant diabetes, or sometimes it can even hurt the new kidney. But by and large, these drugs have been tested and found to be quite beneficial. That's what keeps a graft going for many years. And I want to say that the statistics from all over the world shows that by 1 year post-transplant, okay, the person is back.
Isaac is back on. Good morning, Mr. Isaac.
Good morning, doctor in the house. Can you hear me?
Yeah, loud and clear. Thank you very much.
Okay, yeah, I have 2 questions to ask.
Please go ahead.
Kidney transplantation. One, what actually causes relapse after somebody may have gone through kidney transplant? Then secondly, this gallbladder, at times somebody can be diagnosed with the gallbladder. So is it curable or managing? Somebody can manage it. Those are the 2 questions I actually want to ask. Then thirdly,
gallbladder, do you mean gallbladder stone?
Yes.
Okay.
Then thirdly, I've been hearing the doctor calling HDL. So I really want to know what is actually that HDL means.
Okay. Thank you very much. HLA.
Okay, let me start with HLA. HLA, like I said, is human leukocyte antigen. So that's the way your body recognizes itself, that it doesn't. You have what is called T cells and B cells. So those are cells that God has put in everyone to be able to recognize your body and not destroy it. But when things like a new organ or an infection like COVID, malaria enters your body is able to attack it and destroy it. Sometimes you may need medications to help. Okay, so that's the way God has programmed the body to have those antibodies, T cells that enable B cells to produce antibodies, and those antibodies fight whatever enters the body as a foreign intruder. Okay, so HLA is how the body recognizes itself and doesn't destroy itself. But once there is a foreign body that is coming in, the body rises up to destroy it. Why does kidney transplant fail? There are many reasons why it
Graft
fails.
failure.
Why does a new graft fail? There are many reasons. We'll just go through what happens in our environment because this is what I practice. most times people may not be able to afford the medications after a transplant because they are quite expensive. And so they may begin to skip drugs or say, let me reduce the dose so that I can have enough to go over months or years. So without consulting their doctors, so that's one thing that makes for graft failure, because once you start reducing those drugs are not able to suppress the immune system anymore, and the immune system will now rise and destroy the graft. So you need a critical balance between the medication to be able to give your, reduce your immunity, as well as to also reduce the chance of somebody having an infection. Okay, because those are some of the side effects that can happen when somebody is on immunosuppressive drugs. There's a chance that the person can have an infection. All right. Now, there are also infections that can affect the graft. The most recent one is COVID-19 infection. It's been shown to affect up to 30% of those that don't even have kidney problems. So if somebody has a graft that is functioning and develops a COVID infection, there's a chance that the person may have kidney dysfunction from that new graft, and if care is not taken, the person may lose the graft. There are other infections like CMV, BK virus that can also cause the grafts to malfunction and eventually be lost. Then there are people that have a very good graft that is working very well, but they have conditions like heart failure or ischemic heart disease. Okay, and these can lead to death with even a functioning graft. So some people who have a good graft can even die, okay, from other causes that is not related to the transplant at all. All right, so other things also that can lead to graft failure is when a disease recurs. So like I talked about earlier on, when people have what is called chronic glomerulonephritis that can occur in the early teens or early 20s.
And what about taking non-prescription drugs by organ transplant patients?
Yes, so after a transplant, you must make sure that whatever you're taking is what is prescribed, because some medications can interact and either raise the level of the drugs, like tacrolimus, or reduce the level. Okay. So if it raises the level too adversely, it could lead to graft malfunction, and if it reduces the level so drastically, it could make the immune system come up and attack the graft. So medications must be carefully watched.
Barth from Abuja, good morning once more.
Good morning, sir.
Yeah, thank you. Go ahead.
See, unfortunately, when he was answering me, NEPA took light in their usual manner. So I have to go back to on my gen.
Yeah.
He was addressing the issue of kidney cysts in those that are above 40. That's where he was answering me and NEPA took light.
Okay. I'm sure he will oblige you. And besides, don't forget, this video can be watched. It will be uploaded on WAP TV, YouTube, so you can go there and watch so many of all the previous presentations we have done in time. But you can share with your friends. Okay?
Yes.
All right, so just to recap, kidney cysts can be something that is inherited. So we'll talk about polycystic kidney disease. Okay, that one is inherited, and it's passed on from either mother or father to the offspring. And then as the person is in their teenage or early 20s, two of the kidneys begin to form cysts, one at a time, and then gradually over some decades, about 2 decades, it can actually fill up the whole kidneys and give rise to kidney failure. All right, so that's what happens with the inheritable form of kidney cyst. The other types come in with aging, which can be something that happens as people clock the age of 50, 60, 70. They form cysts, but those cysts doesn't usually affect their kidney function. It's something that stays there for a lifetime. And I also talked about the fact that some people on dialysis form cysts, and you don't do anything about it. You just leave it there. Yeah, so that's...
Thank you very much, sir. I have 2 questions in one. At what age? What is the age range, okay, within which one can donate a kidney? That's number 1. Number 2, are there contraindications to kidney transplant in some individuals?
So the earliest age approved for most parts of the world is about the age of 18, and then a cap in terms of the eldest or the oldest person that can donate is about 65. But people above that have also donated if they are healthy enough. Like you saw from the videos, we usually screen a donor from head to toe to be sure the person doesn't have any
Just a
issue
minute.
at all.
Moses from Bauchi. Moses, good morning.
Morning, sir.
Yeah, how are you today?
Fine, sir.
Okay, please go ahead.
Sir, I have this issue that I want to make a clarification, sir.
Yeah, go ahead.
Because I went to specialists and I told them my problem. I said my chest, right hand of my chest, when I breathe in, I'll feel pains, severe pains. But if I should remain like that without anything, I don't feel pains. But when immediately I breathe in, I feel pains. So I went to specialists, to the scanning site. I told them that look at what is happening to me. Then I said, okay, that is a normal thing, that it will go by itself. Without doing the scanning, they said it will go by himself.
So has it gone now?
Oh, when I breathe in, it do pay me.
It's still there?
Yes, sir.
Okay. Thank you very much. You may need to go back to them or probably visit another hospital if it does persist. Okay, because there are a couple of imaging investigations that you can have done. Chest X-ray can be done to find out what is going on there. Usually we don't take symptoms like chest pain with levity. Okay, it's a serious one. Once you give us such complaint, we must explore. We must evaluate the patient fully to find out what is going on. Okay, thank you very much. Yeah, Chief, back to the question I dropped. Contraindications.
So contraindications will include if somebody has...
That's contraindication means things that can make one unable to get a kidney transplant. Should the person be requiring one? Okay, we need to drop the medical jargon.
Yes, so things that will make us not to go ahead with a transplant. If somebody has a very bad infection, an infection can be the usual infection that people have. Okay, is a very bad infection, an abscess, because when you take the medications after transplant, that abscess can flare up and cause a life-threatening infection. So any infection, abscess, HIV that is not controlled, hepatitis B that is not controlled, hepatitis C that is not controlled. And in the present day, if somebody has not been vaccinated for COVID, you don't want to transplant that person because the person can be at risk of contacting COVID. So we advise people who have had a transplant or those on dialysis to go ahead and do their vaccination. It helps them to avoid infection. So that's one. Infection is one. The other thing is somebody who has a very bad cardiorespiratory problem. If somebody has a very bad heart condition, if you give the person a new kidney, the person may still not be able to recover the heart function. All right, so usually we also, apart from screening the donor from head to toe, we also screen the person that will be transplanted and do careful evaluation of the cardiovascular and respiratory system to be sure that this person's heart and lungs are very okay. Because sometimes what has caused the kidney failure, like hypertension or diabetes, can also affect the heart. And in that way, it makes the heart very difficult, or it may make the heart to be in a state that we can't go ahead and do a transplant. Somebody who's also on drugs cannot... Substance abuse.
Yes.
Somebody who's abusing substances cannot be transplanted except they've gone through rehabilitation to be sure that they will not continue that habit afterwards.
Thank you very much. I'm afraid we can go no further. Thank you very much for coming around.